The other program, which I think is even more exciting, that program ultimately relies on parents learning and responding and doing the right thing. Now we know there are parents who are, in spite of that sort of program, still not going to get it together. And these could be parents with significant mental health problems, with major addictions that they can't get on top of. Joseph Sparling's program, on the other hand, Sparling and Oles turned out to be good friends, which I only found out because they both were in Alice Springs on the same night, and we were having dinner together, and it was very tense because they hadn't talked for, 16 years. They had a big falling out, and the falling out was Sparling decided to go with the child, and his whole approach was on stimulating kids, and Oles decided to go with the parent and the family. And now they realise you've got to do both. But the benefit of Sparling's approach is it works in spite of, if nothing happens in terms of what's going on at home, you take the children out and put them in educational daycare, 8 hours a day, 4 days a week, and you stimulate them. And you stimulate them through conversational reading, through learning games, and enriched caregiving, and you have one carer to 4 children, and the carer doesn't have to be a trained person. They can be a community member that's trained up. He's developed 200 learning games, and they're really easy, they're fun. You play them with kids and you play them in order, and if kids get to learning game 200, they'll have good brain development by age 4. He's done more randomised controlled trials than anybody else. The trouble with Sparling, he's a really reserved, quietly spoken person who hasn't managed to get a meeting with the President of the United States, whereas Oles is an entrepreneur. He's met every president, he's met the Prime Minister of England, his program's in 137 countries. He knows now how to sell it, whereas Sparling hasn't sold this program in the way he should. But his data's even more impressive. The outcome of this program is better than the Oles program. And he's followed some kids up for 30 years, some for 20 years. Again, he's shown children who get educational daycare before the age of 5, the odds ratio that by age 18 they'll have a healthy, active lifestyle is nearly 4. Now, if there's to get a medicine listed on the pharmaceutical benefit scheme, you only need an odds ratio of about 1.3. And, that gets listed and the government pay for it. Here's a program that does much better than that, and no one's paying for it. If you could turn it into a medicine, we'd be right. We'd put all the kids on it and we'd get these outcomes. This shows children, this is one of the studies showing the blue are the kids that got the intervention, the red are the kids that didn't, match control. So these are all children from very poor neighbourhoods, single parents usually, overcrowded houses, exposed to violence, all those things. But you can see, like what Marmot showed, the kids that don't get the intervention, by age 3, nearly half of them have a subnormal IQ. And the kids that do get the intervention, 95% are above normal. So you can really stop the decline that would otherwise happen in cognitive function. And as I said before, that decline is not reversible. It also shows it works against the social gradient. So on the right-hand side, you've got children from families where one or both parents had a university degree, and the program made absolutely no difference to their development. On the left-hand side, both parents have year 10 or less, and the program makes a 25-point IQ difference. And that's the difference between, so you see the kids who've got the intervention and the kids that didn't in red. And so you can see that those children in red would enter school with an IQ of 84, 85, and they will not do well in school, no matter how good the school is. Whereas the other kids are entering with an IQ greater than 100. That's the difference between actually being able to take up transition well and learn and start to thrive in school compared to dropping out. So it's a very significant outcome. This is our own data from Congress, from our preschool program. So at Congress we've got a preschool program. We have a child psychologist, a social worker, an early childhood educator. And in our clinic, one of our recalls for all 3 and 4-year-olds is, are they enrolled in preschool? So when you get a 3 and 4-year-old in the clinic, you ask them, are you enrolled in preschool? If you're not, they get referred to the program. They assess all the kids, and then they're finding kids with significant delays. They're then providing a 7-week intervention based on the abecedarian program, and this is the outcome from 7 kids from one of those interventions. And you can see these are kids, and the child psychologist does a Bailey's assessment on them, which is a much more sophisticated version of the AEDI. So it's assessing their development in those same domains, but in a more sophisticated way. And he does it before and after the intervention. And he's shown that one child improved 12 months their vocabulary, reading vocabulary, after a 7-week intervention. all have improved. The average is nearly 6 months, all improved, some more than others. So even at age, these are kids around 3.5, you can still make a big difference at 3.5. But this is only happening in a small scale in one place. It needs to be happening across the NT. And if we combined home visitation and educational daycare with then therapeutic childcare for children who are falling out of, if you're delivering educational daycare across the whole population, as soon as kids aren't able to progress in the learning games according to age, you've got a problem. You don't have to have a massive assessment team for fetal alcohol spectrum disorder made up of an OG and a whatever. You just need to provide a universal intervention, and the children that are behind will declare themselves. Now, there's other interventions such as therapeutic childcare.